Are you taking magnesium supplements every single day thinking you're doing your heart a favor? In this video, I'm going to show you why taking too much magnesium could actually be damaging your heart and the shocking signs you need to watch out for. You absolutely have to know this. Hey everyone, and welcome to Revitamine. We're going to cover everything you need to know about magnesium supplementation for seniors, but make sure you stick around until the end because the #1 sign of magnesium toxicity is the one that sent my own father to the emergency room, and I guarantee it will shock you. All right, let's not waste any time. The biggest mistake most seniors make when it comes to magnesium, and we're starting with a huge one, is mistake number 7, taking magnesium without knowing your current magnesium levels. Let me explain why this is so critical. Here's what most people don't understand. Your body is incredibly sophisticated at regulating magnesium levels. Your kidneys work around the clock to maintain the perfect balance. When you're healthy and your kidneys are functioning properly, they excrete any excess magnesium you consume through your urine. But here's the problem. As we age, kidney function naturally declines. By age 65, most people have lost about 30 to 40% of their kidney function compared to when they were in their 20s. This means your body's natural safety mechanism for getting rid of excess magnesium becomes less effective. So what happens when you start supplementing with magnesium without first getting your levels tested? You're essentially flying blind. You might already have adequate magnesium levels. In fact, studies show that true magnesium deficiency in developed countries is relatively rare, affecting only about 2 to 15% of the general population. Most seniors who think they're deficient aren't actually deficient at all. They're experiencing symptoms that could be caused by dozens of other factors, like dehydration, low potassium, vitamin D deficiency, or simply the natural aging process. But they read an article online or saw a social media post about magnesium being a miracle mineral, and they start supplementing without any medical supervision. Here's what makes this even more dangerous. The symptoms of magnesium deficiency and magnesium excess can actually overlap. Both can cause muscle weakness, both can cause fatigue, and both can affect your heart rhythm. So you might actually be making your symptoms worse while thinking you're treating them. If you can just fix this one thing and get proper testing before supplementing, you'll already be ahead of 90% of people. And if you thought that was a game changer, you have no idea what's coming. The final mistake we'll cover is even more important and could literally save your life. Okay, moving on to mistake number 6, which is combining multiple magnesium supplements without calculating your total daily intake. This is incredibly common, and I see it all the time. Someone will be taking a multivitamin that contains magnesium. Then they add a separate magnesium supplement because they heard it helps with sleep. Then they're also taking a calcium-magnesium combination for bone health. Oh, and their doctor prescribed them a medication that happens to contain magnesium. And they're drinking magnesium-enriched water, and they're using magnesium oil on their skin. Do you see the problem here? Each individual source might seem safe on its own, but when you add them all together, you could easily be getting 2, 3, or even 4 times the recommended daily amount. The tolerable upper intake level for supplemental magnesium set by the National Institutes of Health is 350 milligrams per day for adults. That's from supplements only, not including magnesium from food. But I've spoken with seniors who, when we actually calculated their total intake, were consuming over 1,000 milligrams of supplemental magnesium daily. That's nearly 3 times the safe limit. Your body doesn't care whether the excess magnesium is coming from 1 source or 10 sources. All it knows is that there's too much magnesium in your system, and your kidneys are struggling to eliminate it. This is especially dangerous if you're taking any medications that affect kidney function. Common medications like ACE inhibitors for blood pressure, certain diuretics, or NSAIDs like ibuprofen can all reduce kidney function, making it even harder for your body to process excess magnesium. Next up is mistake number 5, which is not understanding the different forms of magnesium and their varying absorption rates. Not all magnesium supplements are created equal. There are at least 10 different forms of magnesium available as supplements, and they have dramatically different absorption rates and effects on your body. Magnesium oxide, which is one of the cheapest and most common forms found in drugstore supplements, has a bioavailability of only 4%. That means 96% of it isn't absorbed and stays in your digestive tract, which is why it's often used as a laxative. On the other end of the spectrum, you have highly absorbable forms like magnesium glycinate, magnesium citrate, and magnesium threonate. These forms can have absorption rates of 30% or higher. Now here's where seniors get into trouble. They might read that magnesium oxide is poorly absorbed, so they think it's safer to take higher doses. But that 4% that does get absorbed still counts toward your total magnesium intake. And if you're taking 1,000 milligrams of magnesium oxide thinking most of it won't be absorbed, you're still getting 40 milligrams of elemental magnesium. Plus, you're giving yourself severe diarrhea in the process.
On the flip side, some seniors switch to the highly absorbable forms and don't realize they need to take much less. If you were taking 400 milligrams of magnesium oxide and switch to 400 milligrams of magnesium glycinate, you're suddenly getting about 10 times more actual magnesium into your bloodstream. This rapid increase can cause immediate symptoms like dizziness, irregular heartbeat, and dangerous drops in blood pressure. Another common mistake is taking time-release or slow-release magnesium formulations. While these sound like a good idea in theory, giving your body magnesium slowly throughout the day, they can actually be problematic for seniors with slower digestive systems. The supplement might not fully dissolve and release all its magnesium before it passes through your system, leading to unpredictable absorption patterns. Now let's talk about mistake number 4, which is ignoring dangerous drug interactions with magnesium supplements. This is absolutely critical, and it's something that could have life-threatening consequences. Magnesium interacts with numerous medications that are commonly prescribed to seniors. Let me break down the most dangerous interactions. First, magnesium significantly interferes with certain antibiotics, particularly fluoroquinolones like Cipro and tetracyclines. Magnesium binds to these antibiotics in your digestive system, preventing them from being absorbed. This means the antibiotic can't reach therapeutic levels in your bloodstream, and it won't effectively fight your infection. If you have a serious infection like pneumonia or a urinary tract infection, this could be extremely dangerous. You need to separate magnesium supplements from these antibiotics by at least 6 hours. Second, magnesium interacts with bisphosphonates, which are medications used to treat osteoporosis. Drugs like Fosamax, Boniva, and Actonel can have their absorption reduced by up to 60% when taken with magnesium. Since seniors are often taking both magnesium for muscle cramps and bisphosphonates for bone health, this interaction is incredibly common and often overlooked. Third, and this is a big one, magnesium can dangerously enhance the effects of blood pressure medications. If you're taking calcium channel blockers like amlodipine or nifedipine, adding high-dose magnesium can cause your blood pressure to drop too low. We're talking about blood pressure dropping to levels that cause fainting, falls, and even strokes. I've personally known seniors who ended up in the emergency room because they started taking magnesium supplements and their blood pressure medication became too effective. Fourth, magnesium interacts with diuretics in complex ways. Thiazide and loop diuretics can actually deplete your magnesium levels, which might make you think you need to supplement. But potassium-sparing diuretics, like spironolactone, can cause magnesium to accumulate to dangerous levels. If you're taking any diuretic medication, you absolutely must consult with your healthcare provider before starting magnesium supplements. Finally, if you're taking thyroid medication like levothyroxine, magnesium can interfere with its absorption. This can leave you with symptoms of hypothyroidism even though you're taking your medication faithfully. The solution is to take your thyroid medication on an empty stomach first thing in the morning and wait at least 4 hours before taking any magnesium supplement. Another common one is mistake number 3, which is taking magnesium supplements at the wrong time of day or with the wrong foods. Timing matters tremendously when it comes to magnesium supplementation, and most seniors get this completely wrong. Let me explain the optimal timing strategies and why they matter for both safety and effectiveness. First, let's talk about taking magnesium with meals versus on an empty stomach. Many people take magnesium on an empty stomach thinking it will be absorbed better, but this can actually cause significant gastrointestinal distress, including nausea, cramping, and diarrhea. For most forms of magnesium, taking it with food actually improves tolerability without significantly reducing absorption. The food helps buffer the magnesium and slows its release into your system, which reduces the likelihood of overwhelming your kidneys with a sudden surge of magnesium. And now, I'll pass the floor to my colleague, Sarah.
However, there's a catch. Certain foods can interfere with magnesium absorption. High-fiber foods, while generally healthy, can bind to magnesium and reduce its absorption. Phytates, which are found in whole grains, beans, and nuts, can also inhibit magnesium absorption. This doesn't mean you should avoid these healthy foods, but it does mean you shouldn't take your magnesium supplements with a high-fiber meal if you're trying to maximize absorption. Calcium is another important consideration. Calcium and magnesium compete for absorption in your digestive tract. If you take a high-dose calcium supplement at the same time as your magnesium supplement, you'll absorb less of both minerals. This is particularly important for seniors who are often taking both calcium for bone health and magnesium for various reasons. The solution is to space them out by at least 2 hours. Now let's talk about the time of day. Many people take magnesium before bed because they've heard it helps with sleep. While magnesium does have relaxation properties, taking a large dose right before bed can be problematic, especially if you have any kidney issues. While you sleep, your kidneys slow down their filtering rate. This means any excess magnesium you consume right before bed will circulate in your bloodstream for longer periods, increasing the risk of toxicity symptoms like irregular heartbeat or breathing difficulties. A better strategy is to split your magnesium dose throughout the day. If you're taking 300 milligrams, consider taking 100 milligrams with breakfast, 100 milligrams with lunch, and 100 milligrams with dinner. This gives your kidneys time to process and eliminate any excess between doses, maintaining steadier blood levels without overwhelming your system. And here's something most people don't know. Alcohol significantly increases magnesium excretion through your urine. If you have a glass of wine with dinner and then take your magnesium supplement, you might think you're being responsible about your mineral intake, but the alcohol is actually causing you to urinate out more magnesium than you're supplementing. This creates a false sense of security where you think you're maintaining good magnesium levels, but you're actually creating a cycle of depletion and excess that can confuse your body's regulatory systems. The second to last mistake, and this is another incredibly important one, is mistake number 2, ignoring the warning signs of magnesium toxicity until it's too late. Magnesium toxicity, also called hypermagnesemia, doesn't usually happen overnight. It develops gradually, and your body tries to warn you with increasingly serious symptoms. The tragedy is that most seniors either don't recognize these symptoms or they attribute them to other causes like aging or their existing health conditions. Let me walk you through the progression of symptoms so you know exactly what to watch for. The earliest symptoms of excess magnesium are gastrointestinal. We're talking about diarrhea, nausea, and abdominal cramping. Now, I know what you're thinking. Diarrhea is common, especially as we age. But here's the key. If you develop persistent diarrhea that coincides with starting or increasing your magnesium supplementation, that's your body's first warning sign. Your digestive system is basically trying to prevent excess magnesium from entering your bloodstream by rushing it through and out of your system as quickly as possible. Don't ignore this symptom. Many seniors make the mistake of taking antidiarrheal medication to counteract this symptom, which allows more magnesium to be absorbed and can accelerate the progression to more serious toxicity. As magnesium levels continue to rise, you'll start experiencing neurological symptoms. These include muscle weakness, especially in the large muscle groups of your legs and arms. You might find yourself struggling to climb stairs or having difficulty lifting objects that were previously easy to handle. Some people experience facial flushing, where their face becomes red and warm. You might also notice lethargy and confusion. These cognitive symptoms are particularly dangerous for seniors because they can easily be mistaken for dementia or stroke symptoms. When magnesium levels reach moderately toxic ranges, cardiovascular symptoms emerge. This is where things get really serious. You might experience bradycardia, which is an abnormally slow heart rate. Your resting heart rate might drop below 60 beats per minute, and you might feel dizzy or lightheaded when standing up. Some people experience hypotension, where their blood pressure drops dangerously low. This can cause fainting spells, which are particularly dangerous for seniors because falls can lead to hip fractures and other serious injuries. You might also notice changes in your heart rhythm. Magnesium affects the electrical signals that control your heartbeat. Excess magnesium can cause ECG changes, including a prolonged PR interval and widened QRS complex. Now, you won't know about these specific ECG changes unless you're being monitored, but what you will feel are heart palpitations, a sensation that your heart is skipping beats or fluttering, and sometimes chest discomfort. At severely toxic levels, magnesium can cause complete heart block, where the electrical signals in your heart are completely interrupted. This can lead to cardiac arrest. It can also cause severe respiratory depression because magnesium affects the muscles involved in breathing. In the most extreme cases, hypermagnesiemia can be fatal. Here's what makes this progression particularly insidious for seniors. Each symptom on its own might seem minor or explainable by other causes. You're tired? Well, you're getting older. Your heart rate is a bit slow? Maybe you're just more relaxed. You're having trouble breathing? Could be your asthma or COPD. But when you're supplementing with high doses of magnesium, these symptoms could be warning signs that your magnesium levels are climbing into the danger zone. The other critical factor is that once magnesium toxicity reaches moderate to severe levels, it can't be reversed simply by stopping your supplements. The magnesium is already in your tissues and bloodstream. In severe cases, you might need emergency treatment with IV calcium gluconate, which works as an antidote by counteracting magnesium's effects on your heart and muscles. You might need IV fluids to help flush out the excess magnesium, or in extreme cases, even dialysis to remove the magnesium from your blood. This is something I see almost everyone doing, and it's sabotaging your results. They wait until symptoms become unbearable before seeking medical help, and by that point, the toxicity has progressed to a dangerous level that requires hospitalization. And now, the moment you've been waiting for. The number one mistake that is holding you back and putting your health at serious risk is continuing to take magnesium supplements when you have chronic kidney disease or reduced kidney function. This is the most dangerous mistake of all because your kidneys are your body's only effective way of eliminating excess magnesium. When your kidneys aren't working properly, magnesium accumulates in your body with nowhere to go. It's like trying to fill a swimming pool when the drain is clogged. Eventually, the pool overflows, and in this case, the overflow can kill you. Here's what you need to understand. Chronic kidney disease is incredibly common in seniors. The National Kidney Foundation estimates that about 37% of adults over the age of 65 have chronic kidney disease to some degree. Many of these people don't even know it because early-stage kidney disease often has no symptoms. You can lose up to 75% of your kidney function before you start experiencing noticeable symptoms like fatigue, swelling, or changes in urination. Now, here's the terrifying part. If you have even moderately reduced kidney function and you're taking magnesium supplements, you're playing Russian roulette with your heart. Your kidneys can't keep up with eliminating the excess magnesium, so it builds up in your bloodstream. Day after day, week after week, your magnesium levels creep higher. You might not feel anything wrong initially because the increase is gradual, but you're approaching a threshold where serious cardiac complications become likely. Let me tell you about my father's experience because this is what made me so passionate about educating people on this topic. My dad is 72 years old. He's always been health conscious, exercising regularly, eating well. About 3 years ago, he started experiencing leg cramps at night. His friend recommended magnesium supplements, saying they worked wonders for his own cramps. My dad went to the drugstore and bought a bottle of magnesium oxide, 500 milligram tablets. He started taking one every night before bed. For the first few months, everything seemed fine. The leg cramps improved somewhat. But then he started feeling more tired than usual. He chalked it up to getting older. He noticed he was getting dizzy when standing up quickly, but he thought maybe his blood pressure medication needed adjustment. His appetite decreased, and he felt nauseous occasionally, but he didn't think much of it. One evening, about 6 months after starting the magnesium, he was sitting on the couch watching TV when he suddenly felt like his heart was beating irregularly. He felt short of breath and extremely weak. My mother called 911 immediately. In the emergency room, they did blood work and an ECG. His magnesium level was critically elevated at 4.2 millimoles per liter. Normal range is 1.7 to 2.2. His heart rhythm was dangerously abnormal. Here's the kicker. We later found out that my dad had stage 3 chronic kidney disease. He had never been diagnosed because he never had any symptoms, and his regular doctor visits hadn't included the specific tests needed to detect it. His reduced kidney function meant he couldn't effectively eliminate the excess magnesium from his daily supplement. Over 6 months, it had built up to life-threatening levels. The emergency room doctors gave him IV calcium gluconate and IV fluids. They had to monitor him in the cardiac unit for 3 days. The doctors told us that if he had waited even another day or two before coming to the hospital, he could have gone into complete cardiac arrest. The magnesium levels were literally on the verge of stopping his heart. This experience changed everything for our family. I started researching magnesium toxicity extensively, and I was shocked by how common this scenario is among seniors. Thousands of older adults are unknowingly damaging their hearts by taking supplements they think are healthy. So how do you know if you're at risk? First, you need to know your kidney function. This is measured by a test called GFR, which stands for glomerular filtration rate. Normal GFR is over 90. Stage 3 chronic kidney disease, which is what my father had, is a GFR between 30 and 59. If your GFR is below 60, you should not be taking magnesium supplements without close medical supervision and regular monitoring of your magnesium levels. The problem is that many seniors have never had their GFR tested. It's not part of a standard annual physical unless your doctor specifically orders it. You need to ask your doctor to check your kidney function before starting any magnesium supplementation. This is not optional. This is mandatory for your safety. Even if your kidney function is normal now, it's important to have it rechecked regularly if you're supplementing with magnesium, especially if you're over 65. Kidney function can decline gradually over time, and what was safe for you last year might not be safe for you today. There are also certain medical conditions that increase your risk of magnesium toxicity beyond just kidney disease. If you have heart block or any type of heart rhythm disorder, extra magnesium can worsen these conditions. If you have myasthenia gravis, a neuromuscular condition, magnesium can exacerbate muscle weakness. If you have hypothyroidism that's not well controlled, magnesium can interfere with your thyroid function. Here's my bottom line message to you. Magnesium is not a benign supplement. It's not something you should just take because someone on social media recommended it or because you read an article about its benefits. Yes, magnesium is essential for health. Yes, some people do have genuine magnesium deficiency that needs to be corrected. But the risks of excess magnesium, particularly for seniors with reduced kidney function, are severe and potentially fatal. If you're currently taking magnesium supplements, please do 3 things. First, get your kidney function tested immediately. Ask your doctor for a comprehensive metabolic panel that includes your GFR and your serum magnesium level. Second, calculate your total daily magnesium intake from all sources, including multivitamins, individual supplements, medications, and fortified foods and water. Make sure you're not exceeding 350 milligrams from supplements. Third, review all your medications with your doctor or pharmacist to check for potential interactions with magnesium. And if you have any symptoms I described today, the gastrointestinal issues, muscle weakness, heart rhythm changes, dizziness, or difficulty breathing, stop taking magnesium supplements immediately and see your doctor as soon as possible. Don't wait for symptoms to get worse. Early intervention can prevent serious complications. So there you have it, the 7 biggest mistakes seniors make with magnesium supplementation. We covered taking magnesium without testing your levels first, combining multiple sources without calculating total intake, not understanding different forms and absorption rates, ignoring dangerous drug interactions, taking supplements at the wrong times, missing the warning signs of toxicity, and most importantly, taking magnesium when you have reduced kidney function. Now, I have a question for you. Which of these mistakes were you making? Be honest and let me know in the comments below. I read every single one, and I want to know if this video helped you realize something important about your supplement routine. If you got value from this video, do me a huge favor and hit that subscribe button so you don't miss the next one. In my next video, I'm going to be talking about the 5 supplements that seniors absolutely should be taking for heart health, backed by real scientific evidence. And trust me, you're not going to want to miss it. Thanks for watching Revitamin, and I'll see you in the next one.